EMDR intensives versus weekly therapy. Which is better? If you're watching this, there's a good chance you already know that you want some kind of support. That part usually isn't the question. The question I hear more often is how to do this in a way that actually helps. Weekly therapy or something more focused, like an intensive. And underneath that question, there's often another concern about time, about how long is this going to take, about how much energy and resource it will require, and whether you have the capacity to keep opening things up week after week, or the capacity to dive in a deep way all at once. Those are great questions. As a trauma therapist specializing in intensives, this is one of the most common conversations I have with clients, and it makes complete sense. Why would I pick one over the other? So people don't usually seek out therapy because there's some small discomfort. They're reaching out because something feels heavy, persistent, or increasingly hard to carry. Panic that keeps showing up, or anxiety that won't settle, or old patterns that keep repeating over and over and over, even if you understand them intellectually. So rather than asking which option is better, I was going to do this, I want to shift the question to which option is a better fit, a better fit for what you are dealing with and how your nervous system works and what kind of support you actually need right now. Weekly therapy is what most people are familiar with. You meet for about an hour, 50 minutes a week, build a steady relationship with your therapist, and you work at a pace that allows for reflection and integration over time. This format can be especially helpful when your goals include something like skill building. Things like you're learning how to regulate emotions or respond instead of react to something, or communicate more clearly, or manage anxiety in the day-to-day of life. And the time in between those sessions becomes part of the work. You try things out, you notice what comes up, and you bring that information back the following week. Weekly therapy is also more covered by insurance, depending on your plan, which can make it more accessible, like a more accessible option for long-term support. So for many people, this pace feels supportive and sustainable. There are times, however, when weekly therapy feels hard, not because it isn't helping, but because the way the nervous system holds and releases material is not optimized for weekly sessions. When there's a lot of unresolved pain from the past, getting to that material takes effort, and your nervous system has to warm up, feel secure enough, and then get going from the gate. It makes sense to describe it like a racehorse, like the horse has been in the gate for a long time. There's your trauma, there's pressure, there's energy, there's a buildup of movement that's been held back or stuck. And then the gate opens, and the horse is finally getting to run. There's momentum, things are moving, and then your session ends, and the horse gets called back before they even reach the finish line. And that stop is so unnatural. It can feel bad to your body. It can feel bad to finally access the material that needs attention, and now you have to shut it down. You have to contain it and go back to your regular life. And week after week, that start-stop pattern can feel really jarring and exhausting. Not because therapy isn't working, but because your system may need more uninterrupted time to complete what it's already trying to do. An EMDR intensive offers a different structure. So instead of spreading sessions out over months or years, the work happens in longer blocks of time over a shorter period. So this format can be particularly helpful when you know there's a lot from the past that hasn't been fully worked through. So not just a single event, but layers of experience, patterns, and survival strategies that still show up in your body and your reactions today. Or it's been a single event, but it was recent and you just want to kick it out. One of the biggest differences clients notice is that intensives reduce the amount of start and stop time. You don't need to spend as much energy refocusing on where you left off, and you're not rushing to contain upsetting material simply because the hour is up. There's more room to stay with the process and allow your nervous system to move through that material in a more complete way. And that extended space feels so good and safe, especially to patterns and pain from the past that haven't been given that space. One thing that I say is that healing doesn't require more time. Sometimes it requires more space. Intensives can be a good fit for people who are looking for relief now rather than small increments of change stretched out over time, not because they want to skip the work or they're looking for a shortcut, but because they're ready to engage in a more concentrated, focused way. Intensives can also be a great fit for high achievers, busy people, or neurodivergent individuals who want to tackle their goals, set aside one focused block of time rather than a weekly hour, or who prefer more space rather than the stop-start of weekly therapy. How do you decide? Weekly therapy and intensives are both great options. Weekly therapy can be a strong fit if your goals include ongoing skill building and you want time between sessions to practice and integrate what you're learning into daily life. Intensives can be a good fit if there's a lot from the past that needs attention, if symptoms feel really urgent or disruptive, or you're looking for more focused relief rather than gradual progress over time. Neither option says anything about your strength, your resilience, or how bad things are. It's simply what kind of support fits you, your nervous system, your life, and your capacity right now. So if you're curious about EMDR intensives and want to learn more, you can visit my website, alliechristycounseling.com, and there's tons of information there to help you reflect on whether this kind of format might be supportive for you. I also offer a free 45-minute consultation if you want to talk to me and ask questions. No pressure, just information. And needing support doesn't mean that you failed. And wanting relief sooner does not mean that you're doing it wrong or you're trying to rush your healing. You're allowed to choose the support. You are allowed to choose the healing that meets you where you are in your life, your schedule, your nervous system, and how you like to heal. Thanks for watching, and I'll talk to you soon.